As we close up this time of honoring and thinking about the global issue of HIV today for World AIDS Day, I am actually really delighted that we have now joining us Dr. Edith Apandi. And Dr. Apandi is as sort of referred to her and mentioned and described, Dr. Apandi is a pediatrician. She's a faculty member at the Moi Teaching and Referral Hospital in Kenya, where our AMPATH partnership operates out of. She is the lead pediatrician for both the AMPATH pediatric HIV care provision services, as well as the specific lead and director of our adolescent-focused services, and who's really spearheading our dream of moving forward an adolescent health initiative in Kenya that would provide comprehensive adolescent health care there. And, you know, I know, Dr. Apandi, this has been a really busy day for you. And of course, it's in the middle of both a growing COVID pandemic, again, in Kenya, as well as, you know, trying to really manage the ongoing significant challenges of what it looks like to provide HIV care in the midst of this for a very large number of adolescents and children living in Kenya. I'm so glad you could join us today for a few minutes as we've tried to honor that. I've tried to honor the stories of the kids that and the youth that we serve in Kenya in different ways as we've been talking today. But I'm really delighted to have you with me to be able to talk about those stories and to share from your perspective and in your own words as well what some of the needs are. I thought perhaps you could start by telling us a little bit about the situation that's facing the youth in Kenya for whom you're trying to provide care at Rafiki, at the Adolescent Center there, perhaps with a story that captures some of the issues for adolescents there and what it's looking like for your clinical system right now. But again, thank you. I'm so glad that you could join us for a little bit.
Thank you very much, Rachel. So at MTRH, we have an adolescent clinic called Rafiki Center, where we serve currently about 800 adolescents living with HIV. Before the pandemic, there were about 1,200. But after the pandemic, we have lost about 400. Not lost, but they are probably in care in other facilities that are closer to them. So currently, we are at about 800. And we also serve adolescents who are not living with HIV who come for other services like PrEP, as well as street youth. We give family planning to all populations of adolescents, whether living with HIV or not. And we also do STI screening and treatment. So since the pandemic, one of the things that I think we have shared with Rachel earlier is that we lost our space that used to be the adolescent clinic. We used to be in a standalone clinic that we were given basically because we wanted to not be in a building that is known to be for people living with HIV, so that the adolescents could feel like it's a safer space, there's no stigma. So we had to move back to the HIV building, and that in itself brought about the issue of having their status disclosed. And it may be one of the reasons why a number of the adolescents are no longer coming there. So since the pandemic also, because of the government strategies to handle the pandemic, like curfews and travel limitations of number of people who can travel at a certain time or in a certain vehicle, traveling has been a bit of an issue. And so we've had a number of adolescents who are coming from far out of catchment who are not able to reach us. And so some of them are able to call us and tell us they've been able to pick medication in the nearest clinic. But for some, we have not been able to ascertain whether they are currently in care or not. And then we do have adolescents whose parents have lost jobs, and even sometimes housing. Some have lost their housing. Some have been locked up, have had to relocate to maybe their rural homes, where after losing their jobs and their housing, and so they are receiving care in their rural homes. And some of those rural homes are in clinics that we can't reach. We do not have the clinic details. So those are some of the issues. And then, of course, those ones who are continuing in care, we have a number who have moved from just low socioeconomic status to quite some almost extreme poverty. So we have a bit of food insecurity among our adolescents. Just today, I was seeing one who survives on like one meal on alternate days. And this is a child who has severe TDF toxicity with, he even got a fracture. And so the mother has had to come to the clinic severally to have, not really a fracture, but the limb deformity that was almost getting into a fracture. So she has had to bring him to the clinic severally for treatment, and she just cannot do it anymore. We have adolescents who are getting into anxiety and depression. Before, I think we used to see more of like anger, but now we are seeing more of that, like anxiety and depression. And most of them are just because of the insecurity that their parents are going through because of loss of jobs and loss of housing. Yeah, so those are some of the challenges we do have from COVID.
Yeah, and I've just seen, as I think you have, even in the last week, we were able to pull together some data from a survey that we did with our adolescents in this area in Kenya to look at the impact of COVID on their families. And just as you're reporting, more than 80% reported that their parents or caregivers or themselves had lost jobs or lost income, and more than a third were reporting issues with lacking food most of the time. So really seeing those specific issues there. I wondered if you could share a bit about how, in the face of these challenges that the youth are going through, how our peer support and counseling services have typically helped adolescents to cope with their illness and with trying to really live as positively as possible. And along with that, we've asked if people who are joining us today, if they're interested and willing to honor World AIDS Day, that we would welcome donations specifically for the support at the Rafiki Center that we'd like to put in place. So if you could maybe talk a little bit about what that psychosocial support looks like and does for the youth, and how any of the donations today would be used by the clinic in that way. I think that would be a helpful picture for people to have as well.
Okay, so at Rafiki Clinic, we generally have peer mentors. We have a male and a female who are on permanent. We call it permanent, but it's not permanent. That is like 9 months to 1 year contracts that are usually renewable. And then we have 2 others who are on voluntary basis. And so the ones who are on voluntary basis are paid stipends. And they generally do the same kind of work, although some are volunteers and others are permanent. So during this pandemic, I think it's one of the periods when we saw their support most, because they were able to, when we moved to the new place, for instance, some of the adolescents did not want to get in there, partly because of the HIV connotation of the clinic, but also at some point our hospital was known to have a lot of COVID. And so the adolescents were trying to keep off from reaching the clinic to avoid the COVID disease. And so the peers would actually pick drugs for some of them. They would reach at some place in town, and then they would contact them and they would say, please pick for me my drugs and bring them to me. And they would do that. Sometimes they would put them the public transport system and transport it to the adolescent wherever they are. And then
I was just going to say, I might interrupt for just a second to explain that these peers are not healthcare workers formally trained. They're youth, young adults who themselves are living with HIV, but who've been trained and are serving this role to really connect with the services in this way. Sorry, just for those who aren't familiar with the service, they're really playing this critical kind of intermediate role with their peers in that way, which is where we call them the peer navigators or peer counselors.
Yeah. So they have also been useful to us in terms of education of the patients on what COVID is, symptoms of COVID, what they should do to prevent COVID, what they should do if they have COVID. At some point, there was a lot of panic over COVID among the people living with HIV, and the youth were asking a lot of questions. Are we going to die? You know, many of them are also not suppressed, and they were thinking now if they are not suppressed and they are immunosuppressed, and then COVID gets into the picture, if they'll really survive the season. And so we used the peers quite a bit to talk to them and just give them some motivation to encouragement to go through the season. They've also been useful for us in adherence support. So the whole program generally went to a phone-based clinic appointments for some months, just before we relaxed and we started realizing it's not hitting us as much as it has hit the other countries. So at some point, people are not coming at all. So we were calling them and educating them not to miss their pills and trying to give numbers that they can call if they're running out of pills. And basically the people who are running this program for us at Rafiki were the peers, because the clinicians were handling those ones who arrive at the clinic. So I think they've been quite useful in terms of education, psychological support, and then practical logistics of getting pills to the adolescents.
Absolutely, and I think they're an incredible model of how, you know, and of course we, you know, want to be able to support them, to pay them to make it a stable option for how we effectively connect youth into the clinical system that way, and can support them even through these incredible challenges with the pandemic that they're facing right now. I know we're at the end of our time that we've set aside for honoring World AIDS Day this way. First, I want to thank you, Dr. Apandi, not only for joining us, but of course, thank you so much for the work that you are doing every day and night to provide care for so many living with HIV in Western Kenya. Thank you too to Dr. Massey and Dr. Seaver and Dr. Posada for your care for patients in that way as well, and for the work that you're doing throughout. And truly, thank you to everyone who's been able to join us for some portion of time this morning, to set aside time to think about how we still are, as we've said, very much in the midst of an AIDS epidemic, that it is not over, that in fact, the COVID pandemic means that, you know, the World Health Organization is estimating that maybe even up to 1 million additional deaths might be happening because of the COVID pandemic among those who are living with HIV or related to HIV as well. So let us recommit ourselves today to not only honoring those who have lost their lives to HIV, honoring those who are living with HIV, but also, I hope, recommitting ourselves as a community, as the Mount Sinai system, as academic partners spanning, you know, across multiple clinic areas and multiple countries, with our partners at Moi University and Moi Teaching and Referral Hospital in Kenya as well, to doing whatever we can to continue to fight against this epidemic as we leave 2020 and move into 2021. So thank you again, everyone. I really appreciate it. We'll close our time today there. Thank you.